Okay, so today we're going to perform some Botox. There are many reasons to do Botox. In this particular patient, who's certainly on the much younger side and doesn't really require it for wrinkling or what we call rhytids, another indication are headaches, namely tension headaches that trigger migraine headaches, and that is in fact what this patient has. Okay, so typically if the tension headache is a trigger point for migraines, there are several places you can inject the Botox to make the muscle stop moving and thereby stop the trigger. In this particular patient, we're going to inject the glabellar region, which is the region between the eyebrows, and get the corrugator muscles, which are the muscles that create the vertical lines in the forehead, to stop moving. When we inject Botox, there's a couple things we tell patients the day of. One is there's no exercise or alcohol intake after the injection, and that mainly has to do with bruising. Both of those increase your likelihood of bruising. It doesn't affect it doesn't alter the efficacy of the medicine, but it does increase bruising. Another thing for patients to do prior, maybe a week prior to the injection, is to stop any medicine products that would increase bruising, like Advil, ibuprofen, Aleve, Excedrin, so on and so forth. Tylenol is safe to take, but as well as fish oil and excessive vitamin supplements, all increase your likelihood of bruising and altering your cosmetic outcome for that first week. So the injection itself is delivered with a very small needle, which we'll show you here in a minute. It's placed through the skin. For this particular region, the glabella, again, between the eyebrows, there's 4 injections. There is a little bit of stinging involved with the injection, but nothing terrible. To offset some of the discomfort, we can use ice packs or put a topical numbing cream on, depending on the patient's pain threshold. But typically, I'd say 95 to 98% of the patients require no other prep before the medicine is injected. And the muscle that we'll be injecting, if you can go ahead and scrunch your brows together for me, is this muscle right here, which creates those vertical lines. And we'll be injecting 2 injections on the left and the right. And that should do a pretty good job. The medicine generally kicks in about 3 to 4 days. It can take as long as 2 weeks. So it's either like a light switch, in that 3 or 4 days it just stops working, or in 2 weeks it slowly decreases its strength.
Okay.
So like I said before earlier, it's a very small needle, which obviously contributes to it not being very painful. That's a 30 gauge needle. That's about as small as you could be. So and then we just basically inject it. It's pretty quick. We feel for the anatomy first. Okay, ready? A little stick and a burn here. Stick. Burn. And stick. Burn. Stick. Burn. And stick. And a burn. And that's it. So that little swelling that's over this area is from the fluid that the Botox is diluted with. This goes away in about 45 minutes. It is often a little pink for about 45 minutes as well, just from me pushing on the area and having the needle inserted into the skin. And then there really are no other restrictions other than the alcohol and the exercise for the day of. And there's no recommended sleeping position or not using the muscles or using the muscles, although that was all said in the past. It's no longer really, at least I don't recommend those to patients. How was it?
It really wasn't that bad. It did sting a little, but it's not bad at all.
Okay. All right, that's good.